Good afternoon, everyone. This is Arif Qureshi again with ICS, and welcome back to the Friday COVID Convo, engaging with our local superintendents on COVID-19 issues. Of course, it's been a pretty challenging week, I think, for some school districts. We're seeing some data come out in terms of the number of school buildings that have actually had in Minnesota a positive case. I think it was recently announced that almost 300 school buildings have had a positive case in their facilities. So clearly we're going to be seeing those challenges as we move forward. And I think as fall comes in, the numbers are going up, and I think you're going to continuously see the challenge of balancing between your current mode of operation to potentially changing to a hybrid or a different model as you go forward. So I think it is very timely, as you hear from some of our other superintendents today, in terms of how they are pre-planning for that and getting kind of ahead of this issue, because we're pretty sure we're going to hit some of those challenging times going forward. Again, thank you. I know we did a survey last time, and we had overwhelming majority of the school districts wanting to continue with the COVID Convo through October. So we've convinced the superintendents to stick with us. I know it's a lot of work and effort on their part, and on the part of even our team at ICS, especially Aaron, who needs to pull all this together. But I think it's a really valuable service to hear from other superintendents on how they're handling this. And I think it'll help in terms of how you put your plans together to move forward. Today's agenda, Fred will talk a little bit about some of the updates we do regularly from MD and MDH, kind of summarizing all that information. And then we'll jump right into the updates from the school districts, talking about the learning models from Mora and East Central, the transition planning as they move to a different model of education delivery, and how they're communicating all these changes on an ongoing basis. We'll also be looking at updates from Bemidji schools. One area is going to involve around tribal consultation and the learning models transitioning. So as you can see, all these districts are dealing with the challenge of starting in one model and having to modify and move forward with a different model. We'll also have Jeremy Kovash give you a quick update from service co-ops and their activity that's going on. And Neil Carlson from the University of Minnesota will talk a little bit about some student behavior issues outside of the classroom and outside of the educational environment that are having a potential negative impact in the classroom. And a little update in terms of outdoor versus indoor risk and respirators going forward. And we'll end with Todd Rapp giving you an update on communication. So again, thank you for joining, and I'll pass it on to Fred.
Yes, and yesterday's phone call with the commissioner at 4 o'clock was really a lot of questions on close contacts. I mean, clearly this is going on in schools, and you hear from the superintendents today what they're doing. But a couple things that she emphasized was that the 15-minute standard is cumulative. It doesn't have to be continuous. And so, you know, during a time period that the person is with positive case or suspected, it's the 15 minutes that someone is with them in the course of that day or time or several hours of exposure. Specifically on transportation, the guidance from MDH is very specific about if you have assigned seats, what close contact means. It's 2 rows. If it's unassigned, the entire bus. It makes it obvious you want to assign seats because then you have fewer close contacts. And then they have another standard that if the entire bus is on the bus for over 30 minutes, doesn't matter if they're assigned or not, the entire bus is considered in close contact, including the driver. She also said that when you get a case, contact your regional support team. Do not email the distance learning link, but get a hold of your regional support team. And clearly from the stories you're going to hear today and from news reports, you need to keep the trust of the parents and students to be honest about this. And it's just really easy for people to want to have a certain outcome and not be as honest with the contact tracing as you would like. And so you really need to work to keep trust and have people understand how important that is. So with that, I think we'll turn it over to Andy.
Well, good afternoon, everyone. Andy Almos, Superintendent of Schools in East Central. Thanks for joining our call again today. Before I dive into my information, I just want to say to the people on the call, you know, the superintendents and the school leaders that are listening in, don't hesitate to reach out, especially to the three soups on this call. I've had some of you call me directly and, you know, just want to talk through things or run ideas by us. And I think all the superintendents here are willing to do that. Hopefully school leaders have their circles of people that they're running things by, and maybe even helping to vent at times and take care of one another. So if you want to call, want to reach out, the superintendents here are willing to chat with you too. So current situation in East Central, we're seeing a dramatic increase in cases in our county. So this week's case rate data is 10.3 cases per 10,000. Next week, public health is predicting our case rate to be 41.58 cases per 10,000. So we're seeing a huge uptick right now. And I'll throw in the caveat that we have a federal prison in my school district. And right now we have 35 cases going through the federal prison. So you can imagine the communication, and we'll get to this more in a minute, but you can imagine the communication issues we're tackling about whether those numbers should be included or not when we're making a school-based decision. But the reality is that's the public number that's out there, and so we have to work through what that really means. The good news is currently, as of 12:10 on Friday, we do not have a positive case in our school system. And I, of course, added the word yet, because we are the only school district in our county right now without a positive case. And so, living where we live, I had a teacher just prior to this meeting come in, and we had to work through this particular teacher lives with a group of teachers from our neighboring schools. And so it's the contact of a contact discussion again. And so it seems like every day, maybe even by the hour, we're working through individual situations like that. We are going to move our high school to the hybrid learning model. Again, if you look at next week's prediction, if you take that case rate number at face value, that says that we should have our entire district in hybrid learning. But we're playing those prison numbers a little differently right now, and the change we're going to make is only in the high school. I've linked there for you our hybrid learning model. If you want to go back and look at schedules and some of the information we're putting out to families, it's linked there. That change will be effective for us next Wednesday. So we are going to give our high school teachers 2 planning days on Monday and Tuesday, where grades 7 through 12 will not be in the building. We are making a change to a block schedule, and our teachers are coming from a 7-period day. So we need to make sure that we have our ducks in a row, and that planning is set to go to make that change. I'll tell you, as a K through 12 campus, everybody under one roof, this was a really challenging schedule to work through. I know it's probably hard to read in the image there, but we have shared staff between the 2 schools. So how do you move to a block in the high school when your elementary already has set schedules for specialists and things like that? So it's kind of a strange high school schedule. For example, Monday, we are going to have, not this Monday, but the following Monday, we'll have periods 2, 3, 6, and 7. That's the Monday block schedule. And that's because of our band and choir and art and those shared teachers. We have to fit that in. So I just have to say it's fun to watch our educators work. They get in the same room and they pencil this out and they make it go. And it seems to be working. But we're going to make that change next Wednesday. All of the Pine County schools are making a learning model change, and we'll talk about that when we get ahead into communication here. A number of years ago, we started a marketing and communications team for our small district. We want to make sure that we're out there communicating with our public. And one of the themes I think we actually robbed from another school district in a different part of the country is this idea of what we call COPE, create once, post everywhere. So we want to make sure that when the superintendent writes a message or the high school principal writes a message, the information doesn't conflict. So if there's any sentence or anything that might be different from communication to communication, we don't want that to happen. So we're going to work together. We're going to create what we put out there once, and we're going to post it everywhere. And what we've actually found is that creates less work for everybody because we do it together. We put it out there and it's a consistent message. So we're going back to what our marketing and communications team has said. We were prepared for this communication chain and to create once and post everywhere. One of the pieces of feedback that we've gotten recently is that our website that lists all of our reopening plans and now our learning models plans is there's a lot of information there. And the question we've had from families is, we don't have time to read it all. We're not going to take a whole afternoon to read all your plans. So how do we find it quickly? How do I find what applies to me so that I know what's happening, especially as we make a learning model change? And so we've actually reached out to families and said, hey, how do you find our information? What's best? And they're telling us social media is huge. Send the link, send the info. It needs to pop up on my phone as a notification. So we're trying to do more of that, especially as we change learning models. A really important thing I think right now with communication is that chain of communication. So we're going to create once and we're going to post it everywhere, but who should see the information first? And the reality is our district leadership team is creating the communication. So they're going to see that information first. They're going to know what we're going to tell everybody. And so that is the first stop. The second stop applies to me, and that's to make sure our school board is aware of what's happening first. We want them to know first so that the community members aren't asking them and they haven't heard what's happening at school. And then we move on to putting it out to staff members. Our staff members in our district, we've committed to telling them that you're going to hear and be able to read the communication before anybody else is, so that they have time to process, get their questions answered, and make sure they can answer questions for the kids and the families. And finally, we're going to put it out to students and into families. We're sending mass messaging through our school messenger system. We're emailing families, posting on social media. We're sending a text message and we're posting on the website. Again, put it everywhere so that there isn't this feeling that we didn't communicate enough. Go ahead there. Right now, we're in the mode of addressing concerns. So one of the big questions we have to answer for our community is, why isn't the elementary moving to hybrid? All of our kids are under one roof, K through 12. So does moving only the high school really limit contamination or cross-contamination with kids? So we're in this messaging stage of going back to the guidance, going back to the 50% occupancy, social distancing, going back and showing them what we're trying to do. But that is a concern we've had many times already as we've put our communications out. So the follow-up now is to answer those questions. Why are we including the prison numbers? And I should have added, why aren't we including the prison numbers? Because I'm getting both sides of that question. So we're actually using the numbers both ways, right? This week we're using it to make a learning model change. And next week we're going to use it so that we say, well, we've been cautious. We're only going to keep the high school in hybrid. So we're going to be continually talking about that. Across our county, all of the school districts have prison employees that work there. So every school district in our county has to talk about those prison numbers and sort through that. We have a community testing event taking place right now. Public health is telling us that our COVID numbers are going to grow, and that's what they're seeing on these big testing events. So we have to be ready to communicate what that means. And if there's another big jump unrelated to the prison, that's going to be one of the big reasons why. We've started talking to our public health department about hospitalization numbers. So as we have our weekly, and now we've actually moved to more than weekly calls, we've been asking the question, given our increase in cases, how many people have been hospitalized or are hospitalized? And the reality is right now, again, as of now, 12/15, there's 0 people hospitalized in our county. We're not doing that to minimize this issue at all, but to help us be able to understand when a family calls concerned or scared, that's information that's really good for us to help talk them through and to keep them working with us. We're going to work to continue to build trust and confidence. We have a high level of trust going with our community right now. We want to maintain that, but we have to build confidence that we're doing the right thing. And I think there's strength in numbers. Again, all of the Pine County schools are going to make this change together. And that really has put some people at ease. It isn't just East Central, it's all of us. All the schools are going together. Now, some of the schools are going to more restrictive models because they've had cases and quite a few in their schools. So they may be moving to distance learning, but there is a step being taken by all the schools. I put in here, I think it's important that you reach out to your media outlets. Let's not wait for them to ask, because whenever they have to ask, it seems about, especially something big like this, the perception sometimes is we're trying to hide things, and we're not. So let's reach out to them, tell them what we're doing, especially as we make this learning model change. I also think it's important, taking some advice from Todd Rapp from a few weeks ago, share the good stuff. Let's get back to what are we doing for kids here at school? Try to slip in some of that stuff that's not COVID related. You can see some of the pictures we put up there on this slide. So that's really important for us to get back to, that kids are learning. We're doing cool things and making sure that the kids are moving forward with their learning, and that's a big deal. And then today, as we wrap up Friday and look to next week of making the learning model change, there's a video message coming out from me, Instagram, Twitter, those kind of things, just to say, hey, we're here, we're making a change, and we're going to take care of folks.
Andy, before we move on to Dan, a question came in, Andy, about how you communicate with bus drivers when you try to communicate to staff first. They're always, they're more itinerant, and you may have contracted staff. So how are you communicating with bus drivers? Yeah,
so we have a transportation company that runs our buses, and the manager of the company, our on-site manager, sits on our district leadership team. So when that communication goes out, he is one of the first people to hear it. And then he has a communication chain he goes back to with his bus drivers. So each department, each building goes back and pushes out that communication. Honestly, I think out in the bus garage, one of the things they do is they print the emails from me and they blow them up as big as they can and they stick them on the bulletin board. And there's one spot that every driver comes in is asked to check that bulletin board. So that's one of the ways we go about it. You know, Fred talked about some of the transportation things at the beginning. We're getting some questions about that. If we get a positive case, you know, how are we going to contact trace back to the buses to make sure we've kept our drivers safe too? And so far, we've been able to alleviate their concerns there.
That's excellent. We have another question, Andy, about the mass testing event. How are you and Pine County Health going to evaluate it? And would it disproportionately influence the numbers in your learning model?
Well, I think it's going to come back to who's positive and where they're from. I mean, our Pine County Public Health is tracking even by zip code where the cases are located. And so I think they'll do the same with positive cases at that testing event. And I think it is going to disproportionately affect our numbers, but we're going to have to take them seriously and try to piece out, dig right down into that data. What are the FCI numbers? What came from the testing event? I'll tell you, just on this line, one of the challenging things we've had is we had a whole group of teachers that wanted to go get tested regardless of symptoms, right? It's a community testing event. They can go do it. Now the question that came back through our union was, do they all have to quarantine while they wait for results? And so we worked with public health, and the answer was no, because they were not symptomatic. But we are telling them to be more cautious, more distant, and to tell us right away once they get those results.
Wow, great detail. Thanks, Andy. Dan, on to Maura.
All right. Good afternoon, everyone. Thanks, Andy, for sharing all that great information. And here at Maura, our current situation, as you can see, is pretty similar to what we're seeing in the surrounding counties of Pine and Isanti and some of the other counties that are near us. And we could see that bubble coming up and the rates going up. So we took notice. I guess something different than we don't have a prison in our county, but we do have some long-term care facilities, and we ran into some of those same challenges that Andy did when they're doing mass testing at those places. And however, now the times have changed. It's the end of September, and we have had a couple of confirmed cases within our school community. We've been very fortunate that we were able to contact trace, and we didn't have to quarantine a bunch of either students or staff. So very, very fortunate because our staff had done the right things by wearing their mask and distancing and things of that sort. I think it's really important for superintendents and your COVID coordinators, your health professionals that you're working with in your schools to ask public health the right questions. Like Andy said, you know, where are the close contacts? You know, because our rates are at 25 or 30, what does that mean for the school district? What is the risk within our school district? The other thing I would say is, you know, it's kind of like looking into the sky and seeing the storm coming. I think that that's a good opportunity for us to start thinking about what do we have to do to prepare and plan and anticipate and share and confirm what we're seeing in the sky is actually going to come and hit us. So greasing the wheels a little bit is very important. So Maura, our case rates are at 25. We found that out, I think, on Monday. We had kind of an emergency meeting with our public health. And so again, we could see in the sky that the storm was coming. So I started to share things with our admin team and our school board, and then eventually our staff. I'm just saying that we're anticipating, because we were going to meet again later the next day and make a decision. So I know that we started this whole process back in August, looking at everybody's school plan and focusing on the hybrid plan, and our numbers were pretty low, like a lot of others. And now here we are, and we created all those plans. We need to go back and open those plans up and share them with our families, share the important pieces that they need to know about our plan. I was pretty proud of our school board members. We had one member last night when we were talking about the hybrid plan and athletics and things like that. And he said, well, it's right on page 21 of our plan. If we go back and look at our plan, we have everything that we need to know to guide us. So, so the plan is there. We got to make sure we go back and use that. I know Andy's mentioned this before, and we do have a transition document that I put together after our first transition that we had to make before school. I felt that I was not as prepared as I should or could have been, so I had to create this for myself, and it really came in handy for me this time when we had to go to a hybrid pre-K-12. And so some of the things that we've been doing is working on our communication with our communication team, and I'll go into that in the next slide, Aaron, if you want to move on. So these are some of the same thoughts that Andy had, so I'm not going to dwell on them, although I think it's important to reiterate that that chain of communication, letting the board members know, and you're anticipating, you're keeping them up to date as much as your admin team. And like I said, I sent out our school team, just said, hey, I want to give you a heads up. I want to give you time to know about this. We're anticipating we're going to have to switch models. I just want you to know and kind of start thinking about that and planning. And we're probably going to get information out to our parents possibly by Wednesday, and we'll probably be moving to a hybrid on Monday of next week. And that's what we're going to do. And so giving that little bit of information to staff, I think, helped ease some of the concerns or questions. Let's see. Yeah, and I shared a link to my message that I shared with parents. I don't know if anybody, if you haven't moved yet or you want to take some of my ideas, feel free to do that. I think it's important, like Andy was talking about transportation, but I was thinking food service. They're going to have to be able to transition. Childcare has been something huge for us that I wish we would have put more time in before, because now that we're hybrid pre-K-12, we have a lot of elementary families that need childcare. So that might be something that you want to start thinking and talking about. I know staffing is going to be a challenge for us. We were able to make this calendar, this hybrid calendar in the lower right-hand side. That might be a tool to help your parents keep track of which kids are going where and when. And then Andy had mentioned the little acronym, but we try to do the same thing of trying to put it everywhere, written, voice, video, email, voicemail, web, social media, all those sort of things. And I guess my other thought would be trying to understand the purpose of the message, the audience, and the information that you want to share, like all those things. So just thinking about what's coming up next, I think Andy hit on it. We need to keep sharing our story, and you can see some of the success stories. We had outdoor testing for our Family Flex members that didn't want to come into school and test because they didn't want to come to school in the first place. So we set up outside testing. And then I think that we're going to get our team together and just reflect a little bit after this hybrid change. What went well? What could have we done better? One of the things that I thought I'm going to do this weekend is come up with more of a written communication plan and checklist. So I make sure that I don't miss anyone or anything, and trying to make sure we communicate our plan. And then I also want to try to solicit some feedback from all the different stakeholders. You know, what did you think of our communication? What did you appreciate? What could you use more of or less of? And just being visible next week is going to be really important. We're moving to the hybrid in the elementary, so I want to check in and make sure that people see that I'm overseeing and making sure things are working properly. And then just going back and reviewing our plan and things of that sort. So Andy mentioned making sure you have a good connection with other people around you. We've started kind of our own little East Central COVID Convo every Wednesday at 1 o'clock. And I think that we've had a couple people ask to join. So it's been really helpful. So I encourage superintendents or school leaders to maybe do that as well. I think that's it from Maura.
That's a great list, Dan. It's always excellent to debrief and also solicit feedback. You learn so much and can make it better. And you give people an opportunity to tell you things that they may be telling others. And so great checklist there at the end. Well, Tim, it's all yours.
Thank you, Fred. Thank you, Andrew and Dan, for your comments. Tim Lutz, Superintendent of Bemidji Area Schools. Thank you for being here, everybody. Good afternoon. Like the other two have said, I think that we have a storm coming in Beltrami County and Bemidji as well. Just this morning, as I was working on my presentation, I was going to say there were 4 cases in 3 of our schools, but since this morning at 8 o'clock, we have a 5th case in a 4th Bemidji area school. We have 2 at Bemidji High School, 1 at Gene Dillon Elementary, which is a 4th and 5th grade elementary school, 1 at J.W. Smith, which is a K3, and then 1 at our middle school, which is a 6th, 7th, and 8th grade. And so our numbers are starting to climb, but so far, according to County Health, we have no spread within our school community. So that's encouraging. What we're doing is working, and I'm very thankful that we have our hybrid model in place, that it's a weekly hybrid trade-off model in our secondary schools. In our elementary schools, we are still all in, but at our secondary schools, we do the weekly hybrid model. And it's nice to have those weekly hybrids because most of our students who are now identifying, coming out with lab positive identifications, were here last week. So they're not really in the building right now, and that really helps greatly. And so they're not in our buildings infecting or spreading the virus. And on top of that, our social distancing and our mask wearing is working. And we're not seeing a lot of any spread yet in our buildings. So happy about that. But what's interesting is just in the last 3 or 4 days, our distance learning program where we have, up until about Monday or Tuesday, we had 824 students in our distance learning program full-time. Once these cases started to become identified, that number jumped to 850. So we increased it by almost 30 people because of concerns about these cases now that are active in our schools. We've learned a lot with our contact tracing. We've had some challenges where, and you've heard this from other school districts in the news, where there has been some dishonesty and some inaccurate information being shared and people not being really forthright And I'm not sure why that is. I think in many cases they think they're in trouble or going to get someone in trouble, or they may think this is still a bit of a hoax and not a big deal. But what happens when we can't have that accuracy, and this has been the case in 3 situations where because of dishonesty or an inability to really identify who within a classroom may have been someone in prolonged contact, we end up having to exclude the entire class. So we have 2 entire classrooms at the high school that we have had to exclude and go into quarantine, and 1 entire kindergarten at J.W. Smith Elementary, which is 13 students. So across our district, we have about 43 or 44 students in quarantine right now. And that's an issue when you can't really say for sure. So that's one of the lessons we have learned so far. And I want to talk about a football team issue. One of our team captains sent out a text to his teammates saying, we don't want to ruin our short team season. We want to make sure we have our 6 games. If anybody contacts you with contact tracing, tell them you haven't been in touch with anybody. And we're on that, we're dealing with it, and we're trying to help the football team and other people realize that if we want to keep our schools healthy, and if we want to have a football season, and if we want to have school, we have to have honesty and the ability and the capacity to quickly and efficiently do the contact tracing that we need to do. On the next slide, get into a little bit more about lessons that we've learned so far, and one of those is just kind of an affirmation of the communication we've been doing. We've been very transparent in communicating to parents and students. You know, if we've had an outbreak with our A-week students, we've made sure all of our parents and all of our students and all of our schools are aware of this situation, because we don't want anybody coming back saying, well, why didn't you tell me about this? We've made sure the media is on top of it. We're also going to start reaching out with all of our other support staff, you know, maybe bus drivers. I think the first time we did this, we neglected a few people because it was more of a need to know, we felt, basis. We've learned since then. We need to make sure everyone knows about this. So all of our bus drivers, all of our custodial staff is going to hear about these things. Where I once did weekly updates to the school board, I'm now doing daily updates. And now I'm doing weekly updates, or more often, to the ISD 31 community of 900 staff members. An update today will be my 2nd weekly update to make sure everybody knows where we're at and what we're doing to prevent this spread. We're getting very positive responses and feedback from our ISD 31 community and from our greater community on that transparency. A success story, the 5th case that happened this morning was at the middle school. The middle school has pods, and they have done a very good job of keeping the 6th, 7th, and 8th graders separated in their pods and not cross-contaminating each other. And we've had a little bit of difficulty with a few teachers in a couple departments who have been frustrated with that. For instance, the music teachers would really like to have larger band and choir and orchestra sessions and classes. We have held to our standards and said, no, we're going to keep them as small groups, ensembles. We're not going to cross-contaminate across pods. And that was proven to be an effective tool today, because when we did our contact tracing, it took very little time to do, and only 1 person was identified as having significant prolonged contact with the student who was identified, and that happened to be a paraprofessional. And so it's working very well at the middle school. So as we take a look at our learning models right now, hybrid secondary, all in elementary, like Dan said, we're seeing the storm coming. Our numbers are really going up. This is our 14-day rolling average, which still looks pretty good. You can see Bemidji there. And our numbers, that's from last week and the week before. Of course, they're 2 weeks behind, but we're seeing the storm coming because, well, before I get to that, I want to point out that those 3 bullet points right now, as we're looking at transitioning, we have 3 criteria we're trying to use as just helping us decide what we want to or we need to do. Whether or not we have a much larger outbreak in our schools will be one of the factors we'll have to consider. Also, whether or not our capacity to do efficient and high quality, high fidelity contact tracing can be maintained. If we lose that ability to do that, even with the help and support of county public health, we may have to switch models. And of course, if our county numbers go up, you can see from that Department of Health set of numbers, that we're under 7 as of the 14-day rolling numbers. But if you look at the next slide, if you can imagine, you see there that in the red, those are our numbers right now. I actually have been looking every day, and if you can picture 7 or 8 days of that graphic coming my way every day from the county. Back on September 16th, we had 32 cases, and our numbers were 6.94 across 10,000. Then starting this Monday, we ended up with 49 cases, which pushed us to 10.63. The next day, we were at 51 cases, which pushed us over 11, all the way up to yesterday's numbers. I haven't seen today's yet. We're at 76 active cases. Our numbers are at 16.49. So we have more than doubled in basically a week's time. So we see the storm coming. And what we're hoping is that our MDH numbers, which are lagging behind, will give us at least 2 weeks' time so we can get close to the MEA break and utilize the MEA break to help us work on a transition. We were one of those few schools that decided to make MEA break a local decision. So on Thursday, we're having our own staff development on that day, and then students and teachers are off Friday. We'll be spending a lot of time on that Thursday working on a potential model transition. We've been meeting with local public health and our Sanford health officials, asking them for support and guidance. And Dan mentioned asking the right questions. We've been doing that. And we have been reassured by county and Sanford Health that we're doing well within our buildings at preventing community spread. But if our numbers start to grow in the county, we'll have to definitely look at a transition. We also have upcoming county testing that'll take place Tuesday, Wednesday, and Thursday of next week. And what's interesting, we're being told, is that, like Dan mentioned, and or I think Andrew as well, those numbers might be artificially high because a lot of people, first of all, will be coming in from outside our county, and we'll have to separate based on zip codes. But also, according to our experts in Sanford Health, many people who are asymptomatic will be coming for testing. And if some of those people are positive, those people may actually be people who've had low dosages of the virus and may not truly affect the community as seriously as we affect. And so we need to look at those individuals and see just whether or not those numbers will affect what we decide to do. So we'll definitely be working with Sanford and public health on those numbers. Changing topics a little bit, since the Department of Education conference call last night, they talked quite a bit about tribal consultation. We have 3 neighboring tribal communities surrounding the Bemidji School District, Red Lake, Leech Lake, and White Earth. We've reached out to them and we've had a really good consultation with Red Lake officials. It was very positive. We held that in August. We discussed a lot about equity of broadband access, access to devices, special education, equity and opportunities. The distance learning equity, 28% of our Native American students are opting for distance learning, which is the highest percentage of any other group or subgroup in our district. And we really want to focus on providing them the supports that they need. And of course, we talked about equity in transportation. So that was a very good discussion. We've also reached out to Leech Lake and White Earth tribal organizations. We've had great conversations with White Earth in the past. We anticipate hearing back from them soon, and we're still waiting to hear from Leech Lake. So in the Bemidji area schools, we have a lot of decisions that we're going to have to make in the next couple of weeks. And we're hoping that we can do a lot of pre-planning because we do see that storm coming. And that's it. That's what's happening in the Bemidji schools. Thank you.
You're muted, Fred.
I was muted. Okay, Jeremy, we've heard some great things from the superintendents. What's going on with the regional support teams?
Yeah, thank you very much. Just probably 3 really quick updates. Regional support teams, you know, as we've heard from all the superintendents, that's the kind of work that is happening across the state. I think Arif opened the call here with a number of districts. I think it was or the number of schools or districts that have been had a COVID positive case, and I think it's 321. I mean, it's virtually touched every school district in Minnesota at this point. I mean, I'm sure there are a few pockets, but for the most part, everyone's dealing with this. So very helpful, guys, and thanks for sharing. 3 really quick updates. One is don't forget to have someone from your district on the COVID coordinator calls, and I believe they are 10:30 Wednesday mornings. And though that came out in the last MDE update, so just make sure you have someone there. I think they're sharing some good and timely advice there. Again, that's in some cases the COVID coordinator for the school district is the superintendent. In some cases it is not, but I would recommend having somebody on those calls, at least even taking notes, for your COVID incident command team or for you as a superintendent or school leader. Shelly Mace just corrected me that's school nurse meeting. So I can't remember the exact time. I apologize. But Shelly can put that in the chat when those COVID coordinator meetings are. Thank you, Shelly. Secondly, there you go. Wednesdays at 10:30. I thought that's what I said, but I probably didn't. So thank you, Shelly. The second piece that we've been talking a little bit about and that are coming around the state now are these testing events. And we are working on a testing event. They have happened. I think one of the earlier superintendents talked about them. We have a couple coming to our region, and they are trying to get at school districts as essential employees. So I was very glad to hear the clarification, and I needed that as well from the Department of Health and the local public health that if you are asymptomatic and take a test, that does not mean you have to quarantine or wait for the results of that test if you are asymptomatic and have not been in contact with someone, for 15 minutes or greater than 6 or at nearer than 6 feet. So in that close contact. So that's helpful. I think those tests are coming around and more to come there. And then the third thing, and Tim just mentioned it, we thought we had a lot of issues surrounding 3rd grade reading and 7th grade math and wait until football starts. So, unfortunately, some people care a little bit more about football and volleyball than they do about 7th grade reading and math. So the complications of events. So here's the scenario we have started to talk about. We could have 2 school districts in the same county that are set to square off in a football game on Friday night. And one of those districts, because the county numbers might, remember now, that's just a baseline. Those county numbers are the same. If those districts decide on their own to go into a distance learning model, those students and participants are still eligible. Should the district make a decision to go to distance learning because of their 14-day numbers and other factors, that will essentially make your sporting events online as well, or remote also, which would essentially cancel that football game. So you are all going to get to do more fun work because people are going to be thinking about football games now along with your learning models. So that'll be a fun new way to do it. And you could have 2 neighboring schools that one is distance learning by choice and one is distance learning by numbers. Because of different scenarios and active and contact tracing, and as Tim mentioned, number of events in your school district and so on. So it could be very complicated. To further complicate, you could have districts for cost county lines that play. I mean, it's just going to be very interesting to see who keeps their football season going and who doesn't. And I'm just using football, but any other activities are also an example. So that'll make things more fun. And we've started to break down that now that the State High School League came out with the football and volleyball clarification or update. So Fred, that's all I really have. The coordinators are busy, and as all of you are busy, I think on average, in our case, I work with 35 school districts, and I would say 5 a day. 5 to 7 school districts a day are calling with a positive case. So, right. And, very good.
Okay, so Melissa Crowley just put in chat, I thought both calls were on Wednesdays, and the nurses call, and I think the coordinator's call is the same call. At least that's the way the commissioner referred to it yesterday. And Jeremy, where would districts find this guidance over the relationship between distance learning and the ability to play or not play. Is that in the high school league guidance? Where is that for people?
Great question. I think in the somebody else can probably help me with that, Fred. I could certainly dig it up, but I think the high school league has essentially come out and said, if you are distance learning, you are mandated to be distance learning, essentially mandated, even though it's local control, because of your 14-day numbers, that you will have no activities. We have school districts that are right now distance learning, that they are indeed participating activities because they have made a local decision to be in a more restrictive environment than their 14-day numbers indicate.
Correct. I remember that from about a week or so ago.
Fred, I could certainly find it and dig it up for you. I'm obviously on my phone and I don't have access to my my computer at this time.
Well, thanks, Jeremy. That's really good advice and a good reminder. So if you're distance learning by choice, you play. If you're distance learning mandated, you don't. Yeah, we'll see what happens to these seasons.
And that's just fuzzy math, as you all know, right? Because it's kind of a local decision if you're quote unquote mandated to go distance learning. It's still a local decision. So it'll be again, more pressure on the wonderful school leaders we have on the call.
Right. Well, we always look forward to is Neil Carlson, because he comes from a different background than us educators at the university, very involved in safety equipment. So Neil, what can you enlighten us with?
Well, thank you. We can go to the next slide, this slide, yeah. I was just on a Asper Tracy conversation yesterday where we talked with healthcare providers all over the country, over 500 of them. And one of the comments that was very helpful was from a representative from NIOSH. And they indicated that because of the shortage of PPE, they are now allowing in healthcare settings, in which, by the way, I think we could move over into school settings, the use of masks or respirators, with exhalation valves. But if you do have the exhalation valve, it must be covered, and you could either do it with duct tape or you could cover it inside or whatever it does. And or you could put a surgical mask over it. The main piece is that if you cover up the exhalation valve, it doesn't do anything that would impede the fit of the particular respirator. Where this may come into play is if you have some staff members that are, let's say, at moderate risk, that are not working from home, but are a little bit higher risk than some other ones, or if they have a spouse or a significant other that's at home that's at higher risk and they really don't want to bring the virus back home, this is a upgraded protective device that could be considered. It's kind of a halfway between healthcare and not, so they aren't restricting, currently they are not restricting it just to healthcare professionals. So it would be a device that could be used by more individuals. We're using it as part of an accommodation for individuals through our disability services office if they have somebody at home. For instance, one person had a wife that was on chemotherapy and he really didn't want to bring the virus back home. So that was the accommodation we made for him. The next. So I'm going to talk about outdoor versus indoor risk, and then we're going to talk about behavior. One of the individuals who was on the coronavirus task force was interviewed by ABC News, and she brought up the information that indoor risk of COVID transmission is 20 times that of outdoor transmission. So that really makes us all focus on doing the right thing while we're inside buildings, or if you can do anything that you can possibly do, like one of the districts did testing outside, doing some creative things like that to minimize the risk is critically important. The concern that I have with respect to behavior, there's been several newspaper reports and television reports about the behavior of students at the University of Minnesota who have decided to kind of let everything hang out and have big parties without social distancing, without masks. Most of this that we can see is occurring outside, but even though we've got a reduction in risk with being outside, if you're close and you're with close to a person for more than 15 minutes and you're bouncing around talking to a lot of different people, it's really a good environment if you want to have a super spreader event. And then we'd have to shut things down. And we're trying to modify the behavior of those students and tell them that this is not acceptable. And in some cases, institutions are actually kicking people out of school for failure to follow this behavior. But from a high school perspective and in elementary school perspective, it's critical to remind we can do everything we can to do it right in the school, but there is a basic responsibility for students and staff to conform and not do these activities that are at risk outside of school.
Yeah. Well, very well said, Neil. The virus doesn't go to sleep. It's there 24/7, indoors and out. Todd, as you begin, one of the questions came up about embargoing information to staff to then allow it to go to the community later. And there are a couple of responses came from Dan and Andy in the conversation. So why don't you take it away from here on communications?
Sure, I'd be happy to, and I'll address that in my few minutes here. I wanted to start by talking about this idea of the storm coming, and I think it's a good way to think about it. I've been working for many years with both of the major nursing home and assisted living organizations here in Minnesota. And in the second week of March, when the first case of this virus hit Minnesota, it wasn't a storm coming, it was a hurricane that hit. What they truly faced there, with only a couple weeks to get ready, very little idea of how to communicate, and certainly no testing and no information like you're using right now, they truly had a full-fledged crisis. So the first thing I want to say to everybody here is that you are not currently in the middle of a crisis. And I know sometimes it may feel like that there's a lot of pressure on you and these days don't look anything like you thought they would. But this is still in effect. We're right now just dealing with a fairly significant problem, but we understand what we need to do to control it well, including how we need to communicate. And all this time you spent since August communicating to both internal and external stakeholders, that you've now shown people to come to you for the best information, and you've given them the basic information that they need in order to be able to understand what you're telling them now, that we need to move to new learning models. All this time has been well invested, and that means that right now we are not dealing with a crisis. We're just dealing with a very difficult situation, and we've put a lot of responsibility on our shoulders, and we can handle it because we're communicating well. I want to call out a few things that the superintendent said. My good neighbor Andy's talked about COPE. I think that's just a great acronym. Andy, I'll send you a quarter so I can steal it at some point, but that was a great piece of advice. I also really like the advice of arming your staff. That is and that is beyond just briefing your staff and getting them information first, but give them what they need to be able to answer the questions that they're naturally going to get from students, from families, and from the community. And I also really like that idea of the round table that I think that came out of Dan, that he's having in Mora. To the extent that you can, weekly, every other week, but as often as you can, having some kind of open event where people can listen to what you have to say about what's happening in the schools and provide questions. That's just a great way of getting the information out. One of my themes has always been, to the extent that we're providing the information, people will turn to us. But if they're not getting what they need, they're going to turn to somebody else. On the question you asked about the embargo, obviously, Fred, every situation it can be different. But generally speaking, I think you should get information out as quickly and as widely as you can. Embargoes tend not to work only because it only takes one person to hear that to say to themselves, oh, I've got a great secret, I got to tell a bunch of people. And now what you're having is communication is being extended through channels that maybe aren't well prepared to share that communication with others. So the sooner you can get good information out, the better. And I think you would rather make mistakes because you got it in too many people's hands too early but at least it came from you and at least it's accurate, than that you lost some kind of control over the flow. I know you all have individual situations that may cause you to think whether that advice is the best advice, and I assure you, use your common sense as you can. But in situations like this, it generally helps to get the information out quickly and widely. The last thing I wanted to say is this. Call or email me with questions. We're all here to try to be a resource for you, and there's no question too small. And if you need any kind of help right now, just drop me a quick note and ask me the question. I'd be more than happy to help give you some advice on your communications challenges that you're having. We're all going to get through this at some point during the school year, and I want to make sure that each of you have what you need to work most effectively with your communities.
Well, thanks, Todd. And a little program alert for everyone to sign up for the October ones, because we're going to be meeting on Fridays except for MEA week. That week, we're going to be meeting on Wednesday at this time, and we're going to focus entirely on communications. And Todd and the superintendents are going to work together, show examples, and looking forward as well as to what to be thinking about as we move into the fall. Halloween is right around the corner. The CDC has issued guidance on Halloween. I think that's going to be a challenge for all of us working with kids and families. If you've been looking at the chat, I really encourage you to do it. Shelley Mace gave some great information about some YouTube links, because there's been so many people on the nurses COVID coordinator call at 10:30 on Wednesday. They've made a YouTube out of it. And I think that should be open for just about everybody. And Neil has put some links in for those respirator masks if you have people with higher needs. Are there any other questions for the team? We would encourage you to let your colleagues know that this is happening. We've got 45, we had 45 people on, and it's a few more than last week. And I think the word of mouth is growing that you learn a lot. I know that I do for sure. So if there aren't any more questions, maybe Arif, turn it back to you.
Sounds good, Fred. So thank you. And then I just want to pick on Jeremy Kobash here a little bit. I think he used the term, and he clearly has a different definition of what we're dealing with. I think he called it fun. I don't think that's what it is. So if Jeremy's there, I think we need to look at which dictionary he gets his words from. I think what it is a challenge, but it's a challenge that I think we're all meeting head on. So I think it's exciting. I got to tell you, I don't come from the educational background. I'm listening to all what you guys have done. It's amazing in terms of how smoothly under these tough conditions that people are operating under. I just want to end with a few things. One is, as you know, we have a website where we're kind of putting all this information on. You can access it easily, all the PowerPoints, all the links, all the contact information. So if you need anything, you can ask us questions, you can ask any of the panelists questions, and we will answer that as soon as possible. I think the other thing is plan for change. I think what you're seeing with the numbers and the data is you will be moving into different types of educational delivery models. You just have to be ready and plan for it in advance, and so that it is a smooth transition when it happens. Of course, it's going to be really tough for even the staff and I think the students. The other thing is, I think in the next few COVID convos, we will be discussing a little about, even though we have in the past, around mental health and what some of these districts have done to address that issue, because it is very challenging. It's challenging for people who already had mental health issues. I think this makes it even tougher as you go forward, along with, of course, the students, not just the staff, but the students themselves. So I think we'll be covering that in a little bit more detail. Communication will be another piece with actual examples so that you can use it. There's actually a checklist on our website for communication purposes. And then finally, I think leveraging local public health. This is, in the end, is still a public health issue that we're dealing with. And I think it's important that we leverage those resources that have been made available to us and really get ahead of this and plan in advance. So just those are the few things. Aaron, I think just want to confirm with you that with the October COVID convos, I think people have to re-sign up, and you, I think, have a different site, correct? Just want to confirm that.
Yes, that is correct. And I did put that link in the chat as well.
Great. Okay. Perfect. Perfect. Thank you. So everyone, thanks a lot for joining us. Hopefully we'll see you again next week. Have a great weekend, and let's connect again next week. Thanks a lot. Thanks, Craig, for that little note. Bye. Bye, guys.